places in a unique position to share his knowledge. His prestigious Center for Healing the Eye promotes wellness of sight, body, mind, and spirit, is focused in Fort Myers, Florida, or located in Fort Myers, Florida. The center treats patients who seek holistic, non-invasive therapies for eye problems that include macular degeneration, glaucoma, cataracts, eye strain, which I think I'm having at the moment, and other eye disorders. Dr. Kondrot has a worldwide following because of these successful therapies. So please welcome Dr. Kondrot.
Thank you. And the reason why I'm the world's leading homeopathic ophthalmologist, because I'm the only one. It's nice to be in that position. But it's really a great pleasure to speak to you on microcurrent. It's been a big part of my practice and life, probably for 15 years. And whatever you do in your practice, microcurrent can be beneficial in helping you. If it's anti-aging, if it's hormones, prolotherapy, you name it, microcurrent should be part of your practice. Disclosure, I'm on the board of directors of iCell, medical consultant for Inspir, and I have no financial support for this presentation. If anybody wants to make a contribution, I will take your money. I believe in synchronicity. New York Times Magazine, on my birthday, May 25th, 2014, dedicated the entire issue on microcurrent and the body electric. Last, Big Pharma is beginning to recognize that microcurrent may have some application in health. If you would like a copy of my book, Microcurrent Miracle Eye Cure, just go to microcurrentbook.com. Easy to remember, and you can download a copy of the book. The book's a little outdated, but the historical aspects are still current even today. I'm in the process of rewriting the book. This book was published in the year 2000, 16 years ago. I like what Dr. Roger Billica said. My office caught fire, the first thing I would save is my microcurrent machine. And he's an integrative doctor, does a lot of cardiology. Believe it or not, microcurrent is FDA approved to treat cardiac problems. How many here were aware of that? There's actually a commercial device out there called the MyoStim, which I'll talk about. Now, if my office caught fire, the first thing I would save would be my wife. She's back there. Not then my microcurrent machine. James Oschman wrote a great book, The Scientific Basis of Energy Medicine. And in that book, he discussed the cell receptor theory. We remember that from medical school, that every pharmaceutical agent attaches to a cell receptor and causes a biochemical physical reaction. So if I smell mint, it's because that mint molecule attaches to my olfactory bulb and I recognize mint. Well, James Oschman, in addition, some Stanford research said that the cell receptor theory is bunk. It's just impossible to work. Statistically, it can't work. The counter-hypothesis is that every drug has a specific frequency or vibration, and this causes the biochemical change in the body. So keep that in mind when I talk about frequency or vibration, because essentially microcurrent is a frequency generator. We're generating frequencies that cause a certain physiological response in the body, which is kind of exciting. Robert Becker, who recently passed away, brilliant orthopedic doctor, and those of you that are in orthopedics, you know that the big problem is getting the bone to heal. And he did a lot of work in working with microcurrent to stimulate bone healing. And he did amazing experiments in salamanders, amputating their forearms and hind limbs. And when he blocked the electrical current, they couldn't regenerate. When he put certain frequencies in, they could. So microcurrent in terms of regeneration medicine is something that I'm excited about in terms of the future for that. So simply put, you hear over and over again, we're supposed to have an alkaline pH. Alkaline pH is healthy. Well, an alkaline pH, your body is rich in electrons. When you're deficient in electrons, you're acidic. So that's one mechanism of microcurrent. It's putting electrons in your body that will give you a more alkaline pH. Now, I was introduced to microcurrent close to 20 years ago when I read an article about Sam Snead having a miraculous cure of his macular degeneration. At that time, I was an eye surgeon. I had no treatment for macular degeneration, so I called up the company and got that device, treated 10 patients. 7 out of 10 had an improvement of vision. I said, holy smokes, this is something I need to give to my patients. I had the pleasure of treating Sam Snead when he was alive, and in exchange, he gave me golf lessons for a week. And everybody wants to know, what did he tell you about your golf game? Well, he watched me hit a bucket of balls, and he asked me to hit a second one. Came up to me, put his arm around me, and says, Dr. Kondrot, here's what I want you to do. Cut back for a year, and then just give it up. So I followed his advice. I haven't played golf in 15 years. And I'm a happier person. This is my son, Sean. When he was 8 years old, he thought he was Peter Pan, and he jumped out of a tree, and he could not fly. He landed on his wrist, broke his pisiform bone. And as you know, there's no circulation to the pisiform bone, and when you're a pre-teenager, there's a problem. You could get a defect, and the doctors wanted to do an open reduction. I said, Sean, while the cast was on, let's hook you up to the microcurrent. We ran it 24/7, and when the orthopedic surgeon took the cast off just to see what would happen, he was shocked that it was completely healed. Lance Armstrong, in addition to his blood doping, routinely used microcurrent. The entire cycling team, they would be hooked up to help regenerate their body. And the 2 athletes on the other side, my wife and myself, world-class athletes, we ran the Marine Corps Marathon. And I had no business doing that marathon. I'm in my 60s, overweight, out of shape, no training. But I finished, but my body was suffering. Normally, when I was in my 20s and 30s running a marathon, it would take me a week to recover. One 30-minute microcurrent treatment completely brought my body back to health and reduced all the pain and inflammation. We also did another test with microcurrent. We did the 500-mile Camino de Santiago pilgrimage. And this is walking 15 to 20 miles every day. And if I didn't have my microcurrent machine, I'd be in bad shape. And this was a wonderful pilgrimage that we did, exploring parts of northern Spain. And actually, I gained weight on the pilgrimage, believe it or not. The food was so good. But the microcurrent machine was my friend. This is me treating my foot, and even a whole body treatment, holding on, reducing inflammation. And I became known as the doctor with the black box on the pilgrimage. And all these people doing the pilgrimage would be looking for me so I could do a microcurrent treatment with them. And this is a Dutchman. No, there's no question that microcurrent reduces inflammation. And there's many, many articles. If you do a PubMed search, it's like a no-brainer. It reduces inflammation and improves circulation. This was a study done, 24 patients who had blockage of the arteries of their lower leg. 10's treatment improved the circulation. Another one with diabetic polyneuropathy. Microcurrent works extremely well with neuropathies. And this is one with chronic leg ulcers. I like this study because these patients did not respond to traditional medical treatments. And then when they had the microcurrent, they had a nice improvement. Now, in terms of the eye, you ask any ophthalmologist, can microcurrent help? And they're going to say it's a scam, doesn't do anything. But this was presented at the ARVO, it's a national meeting, Ophthalmology and Research in Vision, where they did a study. They had surgically induced glaucoma in these animals, and they were divided into 3 groups. And application of electroacupuncture at 2 hertz provides neuroprotection by preserving retinal function in rats with experimental glaucoma. And the conclusion is low-frequency electroacupuncture may be an alternative therapy in the treatment of glaucoma. Now, it's unfortunate because glaucoma is a serious disease, and even with traditional treatment, these people are slowly losing their vision and going blind. And I've treated many glaucoma patients, and I'll show you some examples that they have had improvement of their vision, improvement of their visual field function in 3 days of microcurrent. So the history of microcurrent actually goes back to the early 1900s, before Big Pharma took over the medical industry. And I like to talk about this in terms of frequencies. Every tissue has a unique frequency or vibration. So essentially what we're doing with frequency specific, we're matching the frequency of the microcurrent with that of the tissue. Much like if you have a tuning fork. If you have two C-sharp tuning forks and they're resonating at the same frequency, there's going to be harmony. So when we match the frequency of the tissue, we're giving harmony to that tissue. Now, I began to understand this a little bit more when I got my ham radio operator's license. When you have a ham radio, first you want to connect with a signal. You want to be on the same frequency. And then once you connect with that person you're trying to talk to, you send another carrier wave with your voice. So microcurrent is like that. We want to resonate with the tissue. Then we send another frequency telling the tissue what to do. Improve cellular activity, reduce inflammation, whatever. Now, my wife and I are doing the Great Loop. Anybody here have heard of the Great Loop? It's a 6,000 navigation. You go up the East Coast, and you go across the Great Lakes. You go down the Mississippi River to Alabama, and then cross over to Florida. So right now, we have 200 more miles to go. Our boat is in Panama City. We just have to cross the Gulf, which is 200 miles of open water, and then we're going to be back home. Now, the reason why I'm telling you this is there's a picture of our boat. This was up the Georgian Bay. And there are some important signals, radio signals we use. 16. When I'm on the open water, I'm clutching that radio frequency and I want to call for help. It's Mayday, Mayday, you're on 16. You're identifying, you're making a connection, then you're giving information. That's essentially what we're doing with microcurrent. Now, the early doctors, they were primarily osteopathic doctors, medical doctors, identified these frequencies. And these frequencies have been tested with the device here. That's called a squeak box. But many times we identify the frequencies empirically. And microcurrent can also be a diagnostic procedure. And you may be asking, like, how can it be a diagnostic procedure? Well, if you're trying to identify a physical problem, let's say I have a sore knee. I run a frequency for inflammation, no help. I run a frequency for spasm, and I get an improvement of my symptoms. Then you know that the pain is caused by spasm. So we don't have pat frequencies for conditions. We actually study what is the physiology, the pathology going on in the tissue, and then we use these frequency pairs to identify a treatment protocol. And this is accumulation Dr. Charles McWilliams, a brilliant alternative doctor who left the country and lives on the island of Nevis, has had this extensive compendium of different frequencies. You name it, there's a frequency. So modern frequency specific deals with thousands of different frequencies, and we have a specific frequency for a tissue and a specific frequency for the disease. For example, the macula has a frequency of 137. Inflammation, 18. Hemorrhage, 18. Edema, 14. So if the macula has a hemorrhage, we put that frequency pair in to treat it.
They don't vary patient to patient.
It depends on the disease. So you're not going to use the macula if you have knee pain. So this is the machine that we use. It's a programmable machine. This is an example of treating the eye. Stress and detox just by simply holding the glove or putting it on the abdomen. And the general rule is you want the frequency to go through the area of tissue. For example, this is treating the elbow. And you can also use it, put it in water because it's a vibration. This is my wife in a hot tub, and she's getting a stress treatment. Now, this is a brilliant pioneer, Howard Leonhardt, who actually mentored with Robert Becker, who I mentioned earlier. And he has a 40-year career working with electrical current, and his interest is in combining microcurrent with stem cells. And that's going to be kind of like the focus of my talk, because a lot of you are beginning to become curious with stem cells, maybe using them in your practice. But combining microcurrent with stem cells is an amazing combination. So I'm going to show you that there is a lot of evidence that should get your attention. These are some of the patents that Leonhardt has received. In particular, patent number 2, electrically stimulating tissues to cause release of SDF1, stromal derivative factor 1, a known stem cell homing signal and potent arteriogenic agent. So one of the biggest problems we have, I'm sure you agree with me, is when you give stem cells, getting them to the tissue you want them to regenerate. So when I treat somebody for the eye, I put those stem cells in the body, and I'm using microcurrent with these particular frequencies to get the stem cells to go to that area. I mentioned earlier that this is a device that has FDA approval. Probably most of you haven't heard of this device, but it's approved for cardiac regeneration. After a heart transplant, after an MI or some type of cardiac event, it regenerates heart tissue using microcurrent frequencies. The big problem after an event with a heart attack is the scar tissue, which causes an irritability, and then you have to be concerned about getting a ventricular tachycardia and these other issues. But don't pay attention to me when I start talking about other conditions outside the eye. You're not going to listen to an ophthalmologist talk about the heart. I feel that the only purpose that the heart has is to supply blood to the eye, and that's the only function of the heart. It's also used for diabetic foot ulceration. Wonderful. If you have patients with non-healing ulcers, diabetic neuropathy, you've got to have them use microcurrent. Limb ischemia. The biggest use of microcurrent in the world is facial rejuvenation. If you're involved in any aspect of facial rejuvenation, PRP, fillers, laser, whatever, you need to combine it with microcurrent. Some of the top plastic surgeons use microcurrent to reduce inflammation after their procedures so they get better results quicker. And the big news is microcurrent used to increase breast size. Hooray! The stem cell bra. Soon it'll be available. But this is what I'm interested in, iCell. I was asked by Howard Leonhardt to become on the board of directors for this company, which I'm excited because for the last 15 years I've been trying to convince my ophthalmic colleagues to use microcurrent. It's been denial, I've been ridiculed, but now I have a major investor in California who's put other products to market, iCell.
Just as a camera lens focuses light onto film, your eyes focus light through your cornea and retina, allowing you to see in focus. When the eyes are damaged, the results could be life-altering. But iCell cares about you. The iCell team is embarking on well-controlled studies to prove the safety of our eye regeneration and vision recovery products. iCell offers 2 eye regeneration products. The first is an implantable bioelectric stimulator and microphone. The stimulator controls the release of SDF1, IGF1, and more than 8 other regeneration-promoting cytokines. The micropump is refilled daily or weekly with our EC15 proprietary eye regeneration composition composed of stem cells, growth factors, anti-inflammatory agents, and eye matrix. The second iCell product is a non-invasive eye patch with an external stimulator and micropump. It is interfaced with the eye through a patch which is worn 20 to 40 minutes a day, every other day. These devices are designed to heal injuries, reduce inflammation, and reduce pain and risk of infection. iCell, just one of the many life-enhancing innovations brought to you by Leonhardt Ventures. Life regenerated.
So my results were accepted for publication on alternative therapies. I looked at 290 eyes that I treated over a 2-year period using microcurrent and other integrative modalities such as IV nutrition, oxidative therapies. But these changes took place over 3 days, and I'm convinced that most of the changes took place because of microcurrent. Oxidative treatments work, major autohemotherapy, ultraviolet blood irradiation, but it takes 3 to 6 months before you get to see visual changes. And of course, Myers cocktail, nutritional IVs, many of you are doing those to help regenerate eye problems. They take months. Microcurrent causes these changes, significant. 2 lines on the eye chart is significant. These are patients that were told nothing can be done to improve your vision. 1 line or more was in the majority of patients, it was 69%. Contrast improved, and contrast is the ability to see different shades. You know, when you're at the restaurant, you get your credit card check and you can't see anything because it's not dark enough. That's the contrast. And we had visual field expansion. All these are really remarkable. Here's an example after 3 days. This dark area is an area of blindness. This is a patient that had a central retinal artery occlusion. After 3 days of treatment, complete resolution. This is an alternative doctor who has bad glaucoma, hemianopic field defect up there. The black is no vision. After 3 days, complete restoration. When I show these to eye doctors, they say, it can't happen. You know, the test was done in error. But these are some of the miracles that we see.
I'm Dr. Carol Benoit, neurologist, and I have just seen Dr. Kondrot for the first time for devastating eye problems that have really put me under for the last month especially. Rapidly worsening eye inflammation and tearing. My basic problem is glaucoma due to autoimmune eye disease called uveitis. And in the hands of 4 conventional ophthalmologists, of course, nothing gets better. I just add eye drops, which I'm rapidly allergic to at this point, and eye visits and costs. And he has significantly reduced the size of a blind spot in my left eye. I am just so thrilled about that. He's improved my visual acuity significantly, 3 lines on the eye chart. My contrast sensitivity is markedly improved. And my comfort level is markedly improved. Every treatment seems to bring greater improvement for me. I've been most impressed with the reduction in my allergic symptoms with the cold laser, but everything helps. I love the microcurrent machine. It gets me more relaxed than anything that I have gone through. But basically to see the improvement that I have just learned about today after this, my 3rd day of treatment, is astonishing, with hope for further improvement in the future. God bless him. Thank God for bringing me here. Thank you.
So if this doesn't convince you to get interested in microcurrent, I don't think anything will. You know, you can read statistics, but when you have that patient in front of you who's seen 4 ophthalmologists, everybody's making her worse, and 3 days with microcurrent, you get this kind of change. Something's happening. The heart rate variability. This is me. Mental stress off the chart. And I tried jogging, deep breathing, to relaxation to get it back down. I tried 10 minutes of microcurrent, took it right down. So it's one thing if you feel good with microcurrent, but you get an objective finding like this immediately. So microcurrent can improve blood flow, stimulate cellular activity, remove scar tissue, reduce inflammation, has a neuroprotective effect. This is a landmark study by Cheng, published in the Clinical Orthopedics and Related Research, where he looked at different levels of current to see what it did in terms of stimulating activity in the rat skin. And he noted that between 50 and 500 micrograms will cause an increase in mitochondrial activity, increase in ATP levels. Now the key is, once you get above 500 micrograms, you get a decrease in cellular activity. That's why microcurrent is not a TENS machine. Don't confuse microcurrent with a TENS. TENS is a milliamp. It deals with thousands of microamps. Over the last 10, 15 years that I've been doing microcurrent, I find that the lower current you use, the better result. Of course, I was telling this to a doctor who was very critical of my work, and he says, well, if less gives you better results, just don't do it at all. It also balances the autonomic nervous system, which I think is really instrumental in helping people immediately. You know that imbalances in the autonomic nervous system is a contributing factor to a lot of disease. Treating neuropathy, depression, detoxification, and stimulating stem cells. Lowers intraocular pressure, reverses macular degeneration, facial rejuvenation, and of course, correct musculoskeletal problems. I know a couple doctors who are using microcurrent after prolotherapy, when you're giving injections in the knee, etc., use microcurrent to help facilitate the healing. When not to use microcurrent, of course, the FDA states you should not use microcurrent on the eye. You shouldn't use it with a pacemaker or seizure disorders, but I've treated patients with pacemakers, but I usually want them to get a letter from their cardiologist saying that it's permitted. So microcurrent has been documented for years. I'm just going to go through this. Let's talk about the research. I mentioned Cheng's article, which clearly demonstrates it has some type of physiological activity on a cellular level. Microcurrent and signal transduction, that it opens calcium ion channels. The ATP, cyclic AMP. And these measurable changes are on different areas. Also, study done at the University of Washington, improving blood circulation, collagen production, elastin production, etc. Cytokine changes. This was a study done by Dr. Carol McMakin, and she had noted that these different cytokine factors, IL-1, TNF-alpha, substance P, there's changes after microcurrent, and this was done in a group of patients with fibromyalgia, beta endomorphs, cortisol, all these took place. So there's a lot of good hard research to show that microcurrent does affect things in terms of the biochemical pathways. This was published in a journal showing that microcurrent influences osteoblastic adhesion. And, you know, the orthopedic guys, they want to get those stem cells for the bone to adhere and cause healing in the bone. The big question is, what can we do to attract stem cells to a particular region? And the answer is the stromal cell derivative factor. And microcurrent is known to stimulate that factor. And I think this is an important adjunctive therapy for all of you that are doing not microcurrent, but stem cells, to get those stem cells to go where they're supposed to go. Cytokine and growth factors, we talked about that. So I want to talk a little bit about my stem cell protocol that I'm using. I think it's important that we prepare the patient. So I have a 2-day program, actually a 3-day program. One, we prepare the patient before the stem cells. The second day, we administer the stem cells. The third day, we do therapies then to keep the stem cells active. Even though I'm doing this for the eye, this might be a protocol that you may want to consider no matter what you are using stem cells for. It's important they discontinue the use of NSAIDs and aspirin. I think you need to address heavy metals, and you need good nutritional support. So if they obviously have their leads off the chart and they have some other toxic metals, that should be addressed before they get stem cells, because I think it's going to interfere with the stem cells dividing in the body and producing an effect. And nutritional support's important. And the analogy I tell patients, you know, if you're a farmer and you buy really expensive seeds and you throw them on dry soil with no water and no sunlight, they're not going to grow. If you got a really sick person that's nutritionally deficient, have heavy metal toxicity, and you give them stem cells, you're not going to get much result. The other thing is you should eliminate any chronic infection. I know patients who have spent $25,000 getting stem cell therapy for their macular degeneration in Europe, and all it did was take care of their lung infection or their sinus infection. So stem cells will go to that area of inflammation, so you got to reduce that inflammation. So in terms of my preparation, the name of the game is improving circulation. So we use a pulse electromagnetic field. The key with that, you want something with a very low intensity, nothing high, gently. So I use the Beamer mat, whatever microcurrent or not microcurrent, pulse electromagnetic field machine you use, make sure it's on a very low intensity. You want to gently stimulate the body. And of course, we have different frequency-specific programs. 49 is improving vitality, 81 is improving secretion, and 1 is the body, 62 are the blood vessels. So we're combining them to improve the circulation in the body, preparing the patient for microcurrent, making their circulation at the maximum level capacity. Then we also do programs specifically for their eye. So if I'm treating macular degeneration, I want to do a frequency protocol to improve the circulation to that particular part of the body. Then the stem cells are administered. Right after the stem cells are administered, we use microcurrent then to improve, optimize the cytokine, stimulate the SDF1 that I talked about, to get those stem cells to really take place in the body and try to guide them to the particular tissue that we're treating. So when I'm treating the eye, I'm doing the microcurrent over the eye, trying to drive those stem cells to that particular area. And then we also have a stem cell stimulation protocol, different frequencies we use to try to get the stem cells to grow. And this is one thing that there's a national study going on called the SCOT study, the Stem Cell Ophthalmic Treatment Study. And what they're doing is they're looking at 3 methods of delivery: intravenous, retrobulbar, underneath the eye, and also intravitreal. The patient series that I'm involved with right now are intravenous stem cells and also retrobulbar. I have done a couple cases of intravitreal, but the risk factor is kind of high. Unfortunately, when you're injecting stem cells in the eye, you need a fairly large bore needle. When doctors give the injection with anti-VEGF factors for wet macular degeneration, they're going in with a 27-gauge needle. And I've been told that you really can't get the stem cells in through a 27-gauge needle. You have to use a larger bore, which makes it a little bit more risky for the eye. So I'm primarily using a retrobulbar injection. And this is the intravitreal injection, which may be indicated in some cases where they actually put the needle in the eye and get the stem cells there. So the research is ongoing to determine what is the best administration. Right now, I feel that intravenous and retrobulbar. If you are a integrative doctor doing stem cells and the patient comes to you with some type of eye problem, I would recommend that you do intravenous stem cells and maybe do microcurrent with the particular application over the eye to get the stem cells to go there. So post-stem cells, we want the patient to continue the microcurrent and use the tissue-specific protocols that I mentioned earlier for that part of the body that you're treating. So I kind of went through very quickly 3 new procedures. One is my Restore Vision program. And I get 35,000 visits to my website a month, and the first question I ask is, who in my area does your program? So I have trained about 20 doctors. I've given up trying to train ophthalmologists, but I find that the integrative doctors, just like you, do the program the best because you understand the body, you understand the basic concepts of functional medicine. Also, microcurrent. I hope that all of you are interested in microcurrent, and you might be involved in or interested in getting trained. And also cord stem cells. I'm not using autologous anymore. The problem with autologous in my age group, I have 70 and 80-year-old people, and I'm taking autologous cells. They're old stem cells. And no matter what you do and how you manipulate them, they're still old stem cells. But when you use cord stem cells, which are now FDA approved, and there's several vendors that are marketing cord stem cells, I think the results are much better, and I'm seeing really good results with the cord stem cells. So this is my 234 program, and you can just type in this URL, 234 program, a live 2-day workshop, and it leaves you educated with 3 amazing procedures you can take back to your practice. And I think that these will certainly give you a 4-figure monthly income increase, and at the same time, really, really helping patients who need help. And all these are done at our ranch. We have a 50-acre ranch in Central Florida. You can fly either into Orlando or Tampa. Tampa's a little bit closer. The 2 days are at the ranch. You have your private room. We serve you meals, and all the doctors have a lot of fun. So just go to the 234program.com. So I do have some time left. So if there's any questions, I'll be happy to answer them. Yes, sir.
So, do you think you could help somebody with, let's say, using PRP to apply microcurrent in their practice?
I don't have any experience with PRP, but certainly based on the microcurrent research in terms of changing the mitochondrial activity, improving inflammation, reducing inflammation, changing the cytokines and other plasma factors, I think it should be considered.
Because it makes sense, it's just a matter of finding some sort of protocol on how to do it. I don't know where you do it, where you find it.
Well, we have all the protocols. We have different protocols. And it's basic reduce inflammation. My favorite microcurrent protocol is just reducing inflammation. When I was on the Camino, I did reduce inflammation. I didn't want to spend time trying to figure out what body part, and I just ran reduce inflammation. Yes? The question is the price of the unit, how do I give it to the patient? This is something I like to empower my patients. This is something that they purchase and use. I program this microcurrent machine specifically for their needs. Then they take it home and use it. So I'm treating an eye patient, they go home with it. They're not dependent on me going to the office a couple times a week to get a microcurrent treatment. And the machine has 5 to 10 protocols, so you can do a detox, stress reduction, inflammation, so it becomes a valuable tool that they can use for other health problems at home. I don't have that much experience in terms of hormone treatment, but I know microcurrent doctors are using it to stimulate the thyroid, adrenal support, insulin. There's one doctor who has hooked up microcurrent on our diabetic patients for insulin support to stimulate the pancreas, and she claims good results. So there's a wide application. My experiences with the eye and my excitement, and I'm happy you're here, is to share with you that you're going to be hearing more and more about microcurrent in terms of stimulating stem cells. Many of you are doing stem cells, but the key is, can we get better results with stem cells? Yes? You girls fight it out. Rochambeau. When I started, I only treated dry. Because there was no treatment for dry. Now, because of the controversy with injections with wet, and studies have come out to show that 20% of people that get wet injection, this is a national study, will develop retinal atrophy. 5-year study, the CAT trials, the comparative analysis of anti-VEGF, showed that everybody in the 5-year study, their vision was worse at the end of 5 years. You know what the ophthalmic surgeons concluded? They need more injections. No, more injections. So yes, my results with wet are much better than dry.
Can you distinguish between, I know you've got microcurrent, but there's also radio frequency and there's monopole, dipole. Can you just give me the comparison of all of that?
Well, that's probably a lecture in itself.
Well, I mean,
But we're using a very low, the key is using a low level of current, microamps, which is a millionth of an amp, and the ideal frequency, or not frequency, current I have found is between 40 and 100 microamps. Do not be misled. There's a lot of machines out there that are voltage machines. They deliver very high current. Now, those high current machines are effective for blocking pain, maybe treating or stimulating acupuncture meridians, but they don't have the effects like frequency-specific microcurrent, where it's a low current with a specific frequency. And it's not a Rife machine. A Rife machine, when Dr. Rife was alive, he said, if any device touches your body, it's not a Rife machine. Rife had a radio frequency generator, a cathode ray tube, extremely high frequencies which were directed to the body. Yes?
I think one of your first charts mentioned cataracts. So do you have anything going on there?
Out of all the things I treat, cataracts are the toughest, because I believe that cataracts are connected to nutrition and heavy metal poisoning. Every cataract patient I see has elevated lead. Harvard study was done to indicate that elevated lead is linked to a cataract, so you got to get the lead out. Now, microcurrent, it's interesting, microcurrent can improve the vision in everybody with cataracts, but the cataract doesn't change. I've treated patients and their first question is there a change in my cataract? No, it's the same. I says, be happy your vision's better. I says, would you rather have the cataract completely gone and your vision worse, like what happens when you have cataract surgery sometimes? Yes?
And when you say removing the lead, you're talking systemically?
I'm talking about cataract surgery, removing the lens.
No, removing the lead, I thought you
Oh yeah, removing the lead is probably the best thing you can do for cataract patients. It's a nutritional problem.
And that has to be done systemically.
Right. And Dr. Levy, who's a big advocate with vitamin C, feels, and I agree with him, that cataracts may be a form of focal scurvy. He feels that periodontal disease, heart disease, and cataracts are focal scurvy. On our ranch in Florida, we had goats. I was surprised that a goat under stress can produce 100 grams of vitamin C a day. 100 grams a day. And as humans, I think humans and guinea pigs are the two mammals that we can't produce vitamin C. So I've treated many cataract patients with high dose of vitamin C, 100 grams a day, and it has caused some improvement. But I think you still need to get rid of the lead. Need to get rid of the lead. All right, well, I want to thank all of you, and I hope maybe I'll see some of you in Florida. One last question? We place it right over the eye. The closed eyelids, right over the eye. We direct a current. The machine costs $2,250, which is, I think, reasonably priced. And as a physician, if you're trained in the microcurrent, you can get the machines at a discount, but the machine has no value because you have to program the frequencies. You cannot buy a machine that's pre-programmed. The company just sells an empty box, so it has to be a physician. Our training will be to help you learn how to program the machine with these frequencies. That's our goal. And it's easy to do. It's easy to do. Inspirstar. 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 This was not supposed to be a commercial meeting, so I'm going to get in trouble. It's the concepts of microcurrent. Okay, thank you, everyone.